Hi, my name is Ariela Hayter, physical therapist, Pilates instructor, and Pilates studio owner. And today I wanted to share for the Pilates instructors what type of cue I generally suggest to stay away from when it comes to working with clients that have neck pain or neck tension. One of the most commonly given cues is to try to tell them to bring their chin down toward their throat. Um, and what I've found with this particular type of cue, no matter what position the client is in, is it typically causes them to forward flex their head and actually reverse the natural curve or lordosis of the neck that we need for our tissues to function efficiently and for there to be less tension in our neck. So rather than cueing chin to throat or chin to chest, one nice cue that I like to give is more about elongation and really thinking about reaching the front part of the crown of the head forward and up and really maintaining that nice curvature of the neck. Many of our neck patients have too flat of a spine. The lordosis has been lost. And so what we want to do is encourage them to keep that lordosis. So what that would look like lying on your back and you're teaching someone chest lift or more advanced variations of chest lift, in general, you want to have hands supporting the back of the head if your client has neck discomfort or neck tension. If you're having them to chest lift without that, then you have more chance of issues. Again, it could be a good progression for that client, but starting off with them having support where their hands are not behind their neck, but they're actually behind their head, like the base of their skull and their suboccipitals. The elbows should be in the peripheral vision, and you're not cueing chin to throat, which is going to be bringing this, or chin to chest. You're not cueing that. You're cueing them to create length in the back of the neck, and even thinking of their hands, giving them a very gentle pull, like elongating their neck, and then creating the longest arc of curve, initiating from the abdomen and the chest as the client comes up. They're looking toward the direction they're moving, their knees, not the ceiling. And then they're coming back and they're maintaining the lordosis of their neck. Again, I'm not here. I'm not here. I've got length in my neck, a little curve that hopefully you can see on film. And then I'm maintaining that curve as I direct my eyes in the direction I'm going. Okay. And then the progression might be only one hand behind the head. And then the final progression is no support once your client has the ability to maintain the support of their neck with a very gentle, elongated curvature or lordosis while they're doing the chest lift exercise. I would love to hear from you if you have any questions or comments about how you like to cue the cervical spine when you're teaching core work with your Pilates clients. That would be great. Again, I look forward to hearing from you. Below is more information about the Clinical Instructor Academy. I'll see you soon.